So, if you're a health insurance broker working with employers, or maybe you're a human resources advisor, or somebody whose job it is to assist employees or enrollees, maybe even in the individual market, help somebody choose a health plan given some sort of set of options, one of the challenges you're always working with is how do you uh, calculate or measure what plan will be optimal for this person based on their needs. Usually, the needs are going to come down to three main categories. It's going to come down to the premiums or the cost of the health insurance. It's going to come down to the coverage level. So, how rich are the benefits is kind of a term that we use a lot, but basically lower out of pocket costs through lower deductibles, co-insurance amounts, co-pays, out of pocket maximums. And then the last thing is networks, access to providers and facilities, hospitals, that kind of thing. Um, so one of the challenges that you have as you're trying to navigate this is how do we pinpoint this for a person so that they can effectively make a decision. And we've seen a number of calculators come out where different people will try and create these precise calculators that will ask questions like how many times do you go to the ER per year, or how many office visits do you have a year. And the truth is those kinds of things are not very practical because most people don't know the answers to those kinds of questions. And even if you did have some rough way of approximating it, it becomes incredibly difficult to begin assigning what the component cost for each of those levels of service would be, so that you can build a precise calculator. So I find that actually a less precise calculator tends to be more effective in helping people make decisions. And what we found is that really the main tools that we can use when looking at a plan is the deductible, co-insurance, and out-of-pocket maximum. And maybe we may update this tool here in the near future and add an RX component, because I think that's the other thing that matters. But the goal is not really, when you're comparing a plan, is not to precisely simulate what a person's actual experience is going to be during the year, their utilization patterns, because you're never going to know that. But it's to be able to ask from a risk standpoint what the implications are from policy A to policy B, and that's probably the last thing I'll say before I run into the data. But is that we have to bear in mind that health insurance is a risk instrument. We're using it to manage risk, and by risk we mean the costs associated with unexpected things happening medically. And so you don't know what's going to happen. So it's not really feasible to sit down and create a precise calculator that says, okay, if exactly these things happen, here's where your expenses will be. So this tool allows us to compare the broad implications of up to 6 health insurance products. You can just choose a product by clicking the plus button, or add a product up to 6. I'm going to keep it at 2, and we'll we're going to give away the link to this website for free. We don't ask for emails, or we don't scrub any data from you, or ask for any give to us in order to take advantage of this. We'll simply put the link up on anywhere where we post this video, and you click the link and you're going to come straight to the calculator. But so what we're doing here is we're comparing 2 plans right now, Plan A and Plan XYZ, I guess, and we're comparing their benefits along deductible, co-insurance, and we're using the member co-insurance amount, so the amount that the member pays in co-insurance, not what the health plan pays, and then the out-of-pocket maximum and the premiums, the monthly premiums that the member pays for the plan. And it's important to keep the premiums on a monthly basis there. And so there we go. That was kind of a slow internet. So when you click the compare button, we get the report. And so what the report is telling us is what the implications of these plans are when you compare them in terms of their out-of-pocket expenses over a range of medical costs and the premium, because those are the 2 factors that you want to weigh. Is you want to weigh what's the effect to me when I consider how much I have to pay for premium, and what's the effect for going to access care, going to the doctor, going to the hospital, or whatever. So the table displays that information on a side-by-side basis. And what you'll see is that when you're comparing plans, oftentimes the optimal plan will depend on some approximation of healthcare expenses. So on the table here, for example, we've got the deductible, the co-insurance, and this is just the information supplied by the user up to this premium per month, and then we calculate the annual premium here. Maximum claims is it's a little bit of math that figures out, based upon deductible, coinsurance, and out-of-pocket maximum, how high your claims will have to be in order for the member to reach their out-of-pocket maximum. And then what the member cost max claims column tells us is if the member reaches their out-of-pocket maximum, when we add the out-of-pocket maximum and the premiums paid by the member to have this policy, how much will the member have paid in total under that maximum scenario? And so for plan ABC, it's going to be $11,000, and plan XYZ, it's going to be $11,800. And so you'd say at a maximum scenario, ABC plan is the optimal plan. But what if the claims are not at the full 21,000? So that's what this claims projection slider does, is it controls the values here in actual expense, and it says, okay, what if your claims are at 6,500, and you can see here that in this case, plan ABC is still the preferred plan, but let's go a little bit cheaper. And here you can see at claims at 4,000, it's actually plan XYZ that's cheaper when you figure the deductible, or not the deductible, but the benefits, and then the premiums. And you can see that on the graph here. So when you're looking at the graph, red is ABC plan, blue is XYZ plan, and XYZ is more expensive. The cost is going up vertically. Medical expenses, so this is the cost to the member, out-of-pocket expenses plus premium, and then going horizontally, we're looking at medical expenses. And so as you follow the red plan up to about here, about 6,000, well, that's 5,500, 6,000, you can see the costs become neutral to each other. So if I ran the claim slider here to 6,000, you can see that the expenses between the plans are equal. So if somehow you hit the magic number of 6,000, it actually wouldn't matter which of the two plans you chose. Your total expense would be the same. But then as we go over 6,000 in medical claims, then as the experience goes on, then the red plan becomes, or ABC plan becomes, cheaper. So the way that you would use something like this is in saying, okay, I may not know exactly what's going to happen to me in a year, but do I have some rough way of approximating how much my total expenses are going to be during a year? Do I, what have I spent in previous years? Do I think that I'm going to have 6,000 in medical expenses or more? If so, then plan ABC is probably a more practical plan. And then if you think you're going to have less than that, then plan XYZ is more practical. But the next question you want to know, and I'm just kind of eyeballing this here, is let's just say I chose the wrong plan and the worst possible set of scenarios happen. Like, let's just say that the worst outcome, where the price spread was the highest. It looks to me like it's about right here at medical claims of 18,500. So we'll run it right here at 18,500. And what we're seeing is if you had chosen the blue plan in this case, your price difference would be about $1,250 or $1,150. So I'm doing this 11,750 minus 10,500. So your price difference would mean that how significant of a loss did I take by choosing the wrong plan? About $1,250 is. So what's useful about a tool like this is not just which plan do I choose, but if I make the wrong decision, how much do I need to sweat the implication of making a wrong decision? So anyways, the tool's free. Feel free to use it as you need. You can share it with other people. You can use it in helping set up your employees, and we will catch you in the next video.